Hi everyone, and welcome back to the channel. Today we're diving into a question I get asked all the time in my practice. Is it safe to drink alcohol while taking methotrexate? If you or someone who has rheumatoid arthritis, psoriasis, or another inflammatory condition, this video is for you. Methotrexate is one of the most commonly prescribed medications for this condition. And for good reason. It works, and there's a lot of confusion about whether you need to completely abstain from alcohol while taking it. Some patients will tell me that their doctors have told them to not drink at all, while others say a glass of wine now and then is okay. So what's the truth? Let's look at what the science actually tells us, because the answer might surprise you. I'll break it down, the latest research, explain the risks, and give you practical advice you can discuss with your doctor. Before we dive into the alcohol question, let's quickly cover what methotrexate actually is. Methotrexate is what we call a disease-modifying anti-rheumatic drug. It was originally developed as a cancer treatment, but at much lower doses. It's incredibly effective for autoimmune diseases. It works by interfering with cell growth and suppressing the immune system, which helps control inflammation and slow disease progression. In rheumatology, we often describe it as our anchor drug. It's usually our first choice before moving to a biologic or other advanced therapies. Methotrexate has been around for decades and is still considered the gold standard for conditions like rheumatoid arthritis. It's effective and relatively inexpensive, and we have a long history and experience with it. Now, here's where alcohol enters the picture. Both methotrexate and alcohol are processed by the liver. Methotrexate can cause liver inflammation in some patients, which shows up as elevated liver enzymes. This is why monitoring liver function regularly in patients with this medication is important. Alcohol, as you probably already know, is metabolized by the liver and can cause liver inflammation when consumed in excess. The traditional concern has been that combining these two may create a double whammy effect on your liver, potentially increasing the risk of liver damage. This is why historically patients were often told to completely avoid alcohol while on methotrexate. In fact, a 1990 paper by Zachary in the British Journal of Dermatology lists alcohol abuse as an absolute contraindication for methotrexate treatment. But is complete abstinence necessary for everyone? Let's look at what the recent research tells us. The good news is that now we have better data to guide our recommendations. A landmark study published in 2017 by Humphreys and colleagues in the Annals of Rheumatic Diseases specifically looked at this question. They analyzed data from over 11,000 patients with rheumatoid arthritis who were taking methotrexate. Here's what they found. Weekly alcohol consumption of less than 14 units per week did not appear to be associated with increased risk of liver problems. For reference, 1 unit is approximately half a pint of beer and a small glass of wine, or a single measure of spirits. The risk started to increase when people consumed between 15 and 21 units per week, and there was a significant increase in liver problems in those drinking more than 21 units weekly. Specifically, those heavy drinkers had 85% higher risk of liver problems compared to non-drinkers. Another interesting study published in 2022 by Smith and colleagues looked at mortality and heart attack risk in rheumatoid arthritis patients. They found that mild to moderate alcohol consumption was actually associated with lower all-cause mortality in RA patients, including those taking methotrexate. This mirrors findings in the general population about potential cardiovascular benefits of moderate alcohol consumption. What's the bottom line here? The research suggests that moderate alcohol consumption, staying below 14 units per week, appears to be relatively safe for patients taking methotrexate who don't have pre-existing liver disease. This doesn't mean everyone should drink, and it certainly does not mean that heavy drinking is okay. But it does suggest that the traditional zero alcohol rule might be unnecessarily strict for many patients. There are some important caveats and considerations. Individual risk factors matter. If you have a pre-existing liver disease, history of alcohol use, hepatitis, or other conditions affecting your liver, your risk is different. The same goes if you're taking other medications that affect the liver. Genetic factors can play a role in how your body processes both methotrexate and alcohol. Some people are more susceptible to liver effects than others. The way methotrexate affects you might change over time. Just because your liver tests have been normal so far doesn't guarantee they'll stay that way. So based on the current evidence, have an honest conversation with your doctor about your alcohol consumption. Don't hide or downplay. Your doctor needs accurate information to help you make the right decision. If you do drink, keep it moderate, below 14 units per week, and ideally with alcohol-free days in between. Know what a unit actually is. In the US, our standard drink are often larger than the UK units used in these studies. A standard US drink contains about 14 grams of alcohol, which is approximately 1.75 UK units. So 14 UK units would be about 8 standard US drinks per week. Never skip your regular blood tests. These are crucial for monitoring your liver function and catching problems early. Symptoms that might indicate liver problems: unusual fatigue, abdominal pain, dark urine, or yellowing of the skin or eyes. If you experience any of these symptoms, contact your doctor right away. Remember that guidelines are based on averages. Your individual risk may be higher or lower based on your specific situation. There are also some special situations worth mentioning. If you're just starting methotrexate, it might be wise to minimize alcohol until you see how your body responds to the medication. Those first few months are when you're most likely to see side effects. If you're planning to attend a special event where you might drink a little bit too much, talk with your doctor. Some patients choose to skip their methotrexate dose that week if they know they'll be drinking more than usual, like at a wedding or another celebration. This should only be done with the doctor's guidance. If you have trouble controlling your alcohol intake, be upfront about this with your healthcare provider. There may be alternative medications that would be safer for you. It's worth noting how medical guidelines have evolved over time. Earlier recommendations often advise complete abstinence from alcohol while on methotrexate, but as we've gathered more information, guidelines have become more nuanced. This is actually a good example of how medicine evolves. As we gather better data, the absolute prohibition against alcohol while taking methotrexate was based on theoretical concerns and caution rather than solid evidence. Now we have better studies, we can provide more precise guidance. Some doctors may still recommend complete abstinence, especially if they're concerned about your specific risk factors, or if they choose to take a more conservative approach. This isn't necessarily wrong. It's just a different interpretation of the risk-benefit balance. I also want to emphasize the importance of regular monitoring while taking methotrexate, regardless of whether you consume alcohol. Your doctor will typically order blood tests every 4 to 12 weeks to check your liver function, kidney function, and blood cell counts. These tests are a safety net. It's your safety net. They help catch any potential problems before they become serious. If your liver enzymes start to rise, your doctor may recommend reducing your methotrexate dose or temporarily stopping alcohol consumption to see if the net levels normalize. And methotrexate generally is a very safe medication when properly monitored. The vast majority of patients tolerate it well for many years without significant side effects. The key is appropriate monitoring and open communication with your healthcare provider. So to answer our original question, is it safe to drink alcohol while taking methotrexate? The evidence suggests that light to moderate alcohol consumption is likely safe for most patients without pre-existing liver disease. Heavy drinking, however, significantly increases the risk of liver problems and therefore should be avoided. Remember that everyone's situation is different, and this video isn't a substitute for personalized medical advice. Use this information to have an informed conversation with your healthcare provider about what's right for you. If you found this information helpful, please give this video a thumbs up and consider subscribing to the channel for more evidence-based health information. Drop any question you have in the comments below, and I'll do my best to address them in future videos. Thanks for watching, and I'll see you in the next one.